as the cruise season, the cruise ship seasons, which is starting normally in April around many regions of Canada. So I do know that colleagues are looking at the proper measures in coordination, obviously, with U.S. authorities and other authorities around the world to make sure that we use best practices, we use science, we use the best advice we can get from our home public health officials, but also coordinating with U.S. officials, because these crews come from the United States, they go to Canada, they go back to the US. I think our primary objective is to ensure the safety of all Canadians, but certainly also taking measure. You've seen when we acted on the Grand Princess, I said at that time it was exceptional, was at the request of the US. We were on a cruise environment, but also we acted very quickly because we wanted to protect and obviously to prevent the spread of the virus in North America. So we're very much lined up with our American colleagues to make sure we are talking on a daily basis as to measures that can be taken to prevent the spread of the virus. I could not give you an exact number as we speak today because, we have consular assistance that's going on. For example, we still have, about 20 people in Japan, which are still in hospital. Now we have people who are going to be in hospital, a few people which are going to be in hospital in Oakland, in California. And all our missions around the world are in a higher state of alert because we know that we will have Canadians. We have Canadians in Italy. There are probably Canadians who might need assistance. We have Canadians who need assistance in Iran. So we have put a protocol inside our mission, first of all, to protect the health and safety of our own employees, because in order to provide services, they need to be protected. But secondly, to make sure that we deploy our resources in the best possible ways, considering, as your colleagues were suggesting, that we have new spikes of coronavirus in different places of the world, so that we have mobile teams, our special response teams that can be deployed very quickly to provide assistance.